It's a Northwest Lifestyle Weekend on Como News. IRG's Health Talk continues.
Our next guest is Jamie Crompton. Midwife is something that, has been around for a long, long time. And she's the Medical Director of Obstetrics, Providence Regional Medical Center in Everett, and a lead midwife for the medical group of Women's Services. And Shannon, this is something that I don't know if we've talked about before.
Yeah, we've had some conversation regarding midwifery, but this is a unique situation where the midwives are collaborating with the MDs in the location of Providence's clinics. It's pretty cool stuff.
All right, here is Jamie Crompton with Shannon O'Kelly.
Jamie Crompton, welcome. How are you?
I'm doing great. Thank you so much.
Well, thanks for joining us. Let's talk about you and what you do at Providence. You're the Director of Women's Health, and that's a big title, but tell us what you do there.
Yeah, so I'm a certified nurse midwife. I trained in advanced practice nursing. I went to Marquette University over in the Midwest, which was lovely. As a certified nurse midwife, I take care of women during pregnancy, labor, birth, postpartum. We also take care of newborns, and we do quite a bit of well women care. So women come in, they need their annual exam. We'll do that for them as well.
So it's obstetrics and gynecological services then with midwifery. And that's what I really want to talk about, a midwifery. Now, let's set it up here a little bit. You're not just a midwife, but you're also trained as a nurse.
Yes.
And then you have a nurse practitioner, which is an additional training. And then you have midwifery training. So, toot your horn here, okay? Tell our listeners how much education you have. It's pretty impressive on I don't have your resume, but I have your information.
Yeah. So you completed a bachelor's program and a graduate education program, exactly, to get to where I'm at. And midwifery, I like to say that we are experts at pregnancy, normal labor, normal birth, and really encompass care for women that want their labor and birth experience in, a nice, natural way, trying to mimic what our bodies would do.
Yeah, that's the question I have is if I'm looking for an opportunity or I'm going to give childbirth or going to be pregnant, and I'm looking at care, midwifery versus normal medical care. I suppose you guys work as a collaborative team, and it's under one umbrella.
For sure. So we often take most of the women that come in not with, without significant health issues as midwives, and then we'll collaborate with our MD colleagues who are OBGYNs at the clinic and in the hospital, and we'll sometimes co-manage care if things become more moderate risk, or if things become more high risk, we say, then we will transfer care to the OBs. It's a great collaborative practice, working together, and it makes it a safe practice for women and their families to have this dynamic sort of flow between both the midwives and the MDs.
I think there's a program called The Midwife on TV.
Yes.
But the reason I bring that up is because I want people to understand midwifery has been around for years and years and years. This is how you were born by a midwife 500,000 years ago, whatever it is. It's been around for a long time. Give us a little historical perspective on midwifery.
Yeah, so midwife means with women, and you sort of brought it forth exactly right? We've been there with women for their births for all time, we'll say. The medical institution kind of swung in about 100 to 200 years ago and started medicalizing labor and birth, and we've gotten great things out of that. We have a nice, safe cesarean delivery that we have available for us now. But still treating pregnancy and labor as a normal process, I think, is really what encompasses midwifery care. Taking a woman through that process in a safe way, educating her, and really respecting her choices and wishes. So it's shared medical decision making around her experience.
Yeah, it's pretty interesting how the birth process, and the delivery process has evolved in medicine. And so, is it fair to say, I'm just going to throw something out and just for dialogue here and conversation, if I'm looking for more of a natural process, is it fair to say midwifery is going to be my choice, or is maybe my first choice versus other choices?
I would give a yes vote to that, mainly because midwives, we enjoy being with women when they're, moaning and groaning and in pain. We like to be there rubbing their backs and helping them make it through those transitions that can be very difficult. But we also have many women that have chosen, and we respect their wishes, to have an epidural as well. So we're not there to argue this way or that way. It's their wishes that we're trying to make happen in a safe way.
Shannon O'Kelly and Jamie Crompton continue their talk right after this on Como.
It's a Northwest Lifestyle Weekend on Como News. Here's Tom Hutler and Shannon O'Kelly with more IRG Health Talk.
We continue our chat with Jamie Crompton on midwifery on Como.
Jamie Crompton's with us talking about midwifery. She's the Medical Director of Obstetrics at Providence Hospital and a lead midwife. That's a big title. And I want to again talk about collaboration, but also let's talk about postpartum, because there's some issues that you probably deal with and folks have and need care.
When women come into the hospital and deliver, they'll stay for about a day or two following their delivery, at which point we're supporting them with breastfeeding, which is crucial for the newborn and the future health of this child. We have plenty of lactation consultants in the hospital, which is great. Once you're discharged from the hospital, then women have the opportunity to go to our postpartum clinic, which is connected right to the hospital, where there's multiple lactation consultants, nurse practitioners that can take care of women the first initial days to help you make it through, which can be a very difficult time. You know, getting breastfeeding established it can be hard for women, so we want to support them as best as possible. The midwives will see women at about 6 weeks postpartum, at which point we talk about future family planning, when their next pap smear is due, encourage them to come back for that. We talk about, if they are planning a future pregnancy, preconception planning is what we call it, where you want to take prenatal vitamins, get updated on all your vaccines between pregnancies. And that is to be able to create just really a healthy pregnancy, woman, and family overall.
It's a very comprehensive program. I mean, obviously, it works really well. Providence you have several clinics that are geared towards obstetrics and women's health. Maybe talk about some of your clinics or some options out there for someone maybe is looking for, someone like a midwife or an OB.
Right. So women call in, and our front desk will direct each woman into the right clinic location based on where they live. We have a clinic in our main Everett campus. We have a clinic in Mill Creek. We have a clinic in Monroe, and we now are opening up a clinic in Marysville, which is great. We're trying to really serve the whole North Puget Sound area. Once you call in, we have a few questions to help sort of risk you appropriately. We'll say, if you have a health issue such as chronic hypertension, or you had a previous cesarean delivery, we might automatically get you in right with an obstetrician. If you're coming in fairly healthy, no significant problems, then we'll get you in with the midwives right away. That first visit, initial examination, ask about your health history, and just make sure we have you cared for by the appropriate provider.
Yeah, a big shout out to the moms out there and women out there. Childbirth is no joke.
Yes.
It is, 9 months of carrying this beautiful life in your body. But the body goes through a lot of different things. And postpartum, I want to give a shout out to physical therapy and in women's health, because physical therapists and women's health, it's come a long way, and we can do a ton for that patient that's experienced some of that postpartum dysfunction.
For sure. We have a program called Centering Pregnancy, which is group prenatal care, and we do have physical therapists come there to help women make it through pregnancy and talk about those postpartum issues.
Well, that's good to hear. And Jamie, thank you for your time. Great information. Thanks for joining us.
Thanks for having me.
All right, that's been Jamie Crompton, Medical Director of Obstetrics, Providence Regional Medical Center, Everett, the lead midwife at Providence Medical Group Women's Services. More info at providence.org. This profession has been around a long, long time.
Oh, it's been around forever. It's interesting employing a lot of younger people in our organization. We have a lot of pregnancies, and I've had some of our folks use the midwifery program at Providence and have really enjoyed it and have spoken highly about their experience.
We're talking tech next on Como.